So good evening everyone. I am Dr. Naveen Porwal, and in continuation to the yesterday's class, today I will discuss regulation of BP. But before that, let me tell you about something about Unacademy. So as we know, in Plus subscription, if you subscribe for Unacademy, there are a lot of free classes, like special classes there on YouTube. Also there are free classes, but if you want to subscribe, you will get almost daily live classes of almost every subject, and there are a lot of structured courses, live test and quizzes, and there is unlimited access. And if you use the code physio10, you will get a discount out of it, 10% discount on this subscription. And there is also a ischemic subscription, and in this you will get a combination of both Unacademy as well as prep letter. You know, in prep letter there are recorded lectures as well as question bank. So on one hand you will be getting live lectures, on others you will be getting recorded one. And these are the features, and this is how it will look in the mobile, and by this you can subscribe, and this is the code. So good evening everyone once again. Good evening Auras, good evening Akshay Gupta. So this is now going to be a ritual for MBBS first year student. So purpose of this class, as I told you yesterday also, these classes are designed mainly for MBBS students, not for NEET PG, but for MBBS or someone who want to make clear their concept. Okay, because your professional examinations are very near. So purpose is to clear all the 10-year paper of the physiology, anatomy and biochemistry. So all educators of Unacademy will be dealing with that. Good evening Rabama, good evening. So continuing yesterday's class, I have discussed about regulation of BP in baroreceptors. So we were discussing about baroreceptor, isn't it? We were discussing about baroreceptors. So these are high pressure baroreceptor or low pressure baroreceptor. In contrast to low pressure baroreceptor, these are actually high pressure. So you must know that there are two types of baroreceptor. One is high pressure, who is controlling your BP, and low pressure are for some other reflex called as Bain-Bridge reflex. Okay, good evening Mridul. These are high pressure baroreceptor. Okay, and one scenario we have discussed yesterday, let me revise for you, then I will discuss other scenario also. This is carotid sinus or aortic sinus, and we have discussed that if blood supply is more, or you can say if BP is increased, if there is increased blood pressure, okay, firing will be more or less, or you can say stretch will be more. So if stretch will be more because of increased blood pressure, firing will also be more. And when firing is more, your purpose is to decrease the blood pressure because blood pressure is already more. So in that case you will inhibit vasomotor center and you will excite cardio inhibitory center, or you can say vagus nerve. So there can be bradycardia because of vagus nerve, because of parasympathetic supply. This I have discussed yesterday. Now scenario number 2, if in any condition blood pressure is low, yes Auras, Akshay, Mridul, Ravarma, if BP is low, stretch is going to be less, firing, what about firing? Firing is going to be less, and if BP is less, you want to increase the BP. So you will excite VMC or inhibit VMC? You will excite vasomotor center, or you will inhibit the vagus nerve, that is cardio inhibitory center, and that will cause tachycardia. And ultimately this will cause increase in the blood pressure. Okay, This is the second scenario. Yes, Priyansh, you are correct. Third scenario is that if you ligate carotid sinus proximally, if you ligate it proximally, what will happen? If someone ligate carotid sinus proximally, okay, if you ligate, blood supply will be less or more. In that case, if you ligate it proximally, blood supply will be less, isn't it? So you can say blood supply will be less. Stretch will be more or less. Stretch will also be less. So firing is more or less. Again, I told you, firing will be less. And you want to ultimately increase BP. So to increase BP, you will excite vasomotor center and you will inhibit cardio-inhibitory center. Okay. So ultimate result, if you ligate carotid sinus proximally, ultimate result will be your BP will be more. Because your carotid sinus will think that BP is less because stretch is less. So ultimately it has to increase blood pressure by causing vasoconstriction and tachycardia. If you inhibit vagus nerve, there will be tachycardia. Now the fourth scenario in your MBBS examination, if you ligate the sinus distally, if you ligate sinus distally, okay, so stretch will be more or less. Yes, Ravarma, stretch is going to be more or less. Now more and more blood is coming but cannot go out. So ultimately stretch will be more, isn't it? So firing will also be more. Firing will also be more. Stretch will be more. Firing will be more. And ultimately what will happen to vasomotor center and CIC? Yes, firing is more. So you want to decrease the BP. So you will inhibit vasomotor center and excite cardio-inhibitory center so that your BP will be decreased. Your BP will be decreased. This is scenario number 4. Scenario number 5, which is done as a treatment option as a for supraventricular tachycardia also, the carotid sinus massage. If you massage carotid sinus, BP is decrease or increase, and why? If you massage carotid sinus, okay, stretch will become more or less. What do you think? Stretch is going to increase or decrease? If you massage carotid sinus, okay, stretch will be more. Yes, stretch will be more. Good. After that, firing will be more. Firing will be more. So it will think that BP is more. So it want to decrease your BP. So for that, it will inhibit vasomotor center and it will excite cardio-inhibitory center. So ultimately your BP is inhibited, and this is one of the few physiological mechanism to control your supraventricular tachycardia. There is a lot of, you can put cold water also, you can do carotid sinus massage, you can do Valsalva maneuver. All these can be done to decrease your heart rate and BP can be decreased. So these are the few scenario in which your baroreceptors are working. Now one thing I want to ask you, that these baroreceptors are most sensitive to which parameter? Carotid sinus and aortic sinus. These two are sensitive to which parameter? Are most sensitive to systolic blood pressure, diastolic blood pressure, or mean arterial pressure? What do you think? It is most sensitive to which parameter? So it is very clearly written in genome that it is most sensitive to the pulsatile pressure. Okay, so this is the sensitivity of the baroreceptors for different types of pressure. So it is most sensitive to pulse pressure, then mean arterial pressure, then systolic blood pressure, and then diastolic blood pressure. So this is something about high pressure baroreceptor. Low pressure are different. That can be discussed in vein-based reflex and all. Okay. So in the series of lecture, I will try to cover all the 10-year paper. So I request students of first year of MBBS to give me 10-year paper in the group so that I can see what are the questions which are asked. So this is about baroreceptor. Now second, I have told you, if mean arterial pressure decreases, yes Bharat Bhushan, you are correct. If mean arterial pressure decreases even below 60, then chemoreceptors will be activated. So these are activated if mean arterial pressure become less than 60 mm of Hg. Yes, Akshay Gupta. Okay, you want me to discuss valsalva maneuver. Okay, I will take a separate lecture on that because I have discussed this. If you remember, we have discussed this in respiratory physiology that if you do valsalva maneuver, for example, if you are defecating, for that you are increasing the intra-abdominal pressure, so that can decrease the preload and that can compress your aorta and that can activate your vagus nerve and ultimately that will decrease your heart rate, and by this it can cause. So valsalva maneuver, splashing cold water, okay, carotid sinus massage, these are the various mechanisms by which you can treat lot of supraventricular tachycardia. Even today, I got a patient in my clinic. Just today, at 7 p.m. There was a girl of 18-year-old, and she came to my clinic today only. So she complained that sometimes her heart rate become more than 150. Okay, only sometimes, once in a while, once in a blue moon. I think once in a 3 or 4 months, she was complaining like that. Then I advised her that you can do. Demonstrated how to do carotid sinus massage, splash in cold water, otherwise no treatment is needed. Okay, other thing is important, you should avoid caffeine and all those things, I have decided. So this is common problem, supraventricular tachycardia. So for that we can use this of maneuver. Okay, Akshay. So I will discuss that as a separate because this question can be asked in your MBBS about valsalva maneuver. What are the physiological indication or what are the benefit or what are the various physiological changes? There are so many phases, phase 1, phase 2, phase 3, phase 4. So I will discuss this is a separate topic. Okay. So we have discussed that mean arterial pressure when it was between 60 to 180 mm of Hg. Okay. Then baroreceptors were working. But suppose that someone met with road traffic accident and there is a lot of hemorrhage. There is a lot of blood hemorrhage. Blood is keep on going and there is no one to pick that patient. Okay, there is no one there to pick the patient and mean arterial pressure keep on decreasing from 80 to 60, then 50, then 40. Then what will happen? Your chemoreceptors will start working. So what are two chemoreceptors? Yes, Nitish Kumar, what is your question? If question asks about general baroreceptor, then MAP or pulse pressure. Pulse pressure is the answer. Most sensitive is the pulse pressure. They work in the range of 60 to 180, but most sensitive is always the pulsatile pressure. Okay. So chemoreceptors are number one, carotid body. This is not sinus. This is carotid body. Number one. Number two is aortic body. What is the location? What is the location of carotid body? In the common carotid artery, and that in the aorta, isn't it? It is in the common carotid artery and this is in the aorta. Everyone knows that. No problem in that. These two are having which cell? Yes, Horus. Carotid body and aortic body are having which type of cell? What is that cell called as? Which cell is present in carotid body and Glomus cell. Very good. Both of these are having glomus cell. So glomus cells are present in chemoreceptors, and they are having which channel? They are having oxygen sensitive. They are having oxygen sensitive potassium channel. That is why they are sensitive to hypoxia, because they have oxygen sensitive potassium channel. Okay, now they are activated by which stimulus? What are the stimulus which can activate your chemoreceptor? What are the stimulus which can activate these glomus cell? Number one, you must be knowing, is hypoxia, of course. They can be, these are peripheral chemoreceptors, and they can be activated by hypoxia, number one. Number two, you can say increased carbon dioxide. This is very sensitive marker. And then it is acidosis. Just to compare with this central chemoreceptor. Central chemoreceptors are activated by what? These are peripheral chemoreceptor. So just to compare with the central chemoreceptor or medullary chemoreceptor, so that you could not forget, what is stimulus for central chemoreceptor? Mainly, I have given you three stimulant for peripheral chemoreceptor. What is for central chemoreceptor? Okay, there can be two options. One is indirectly it is activated by increase in carbon dioxide, and directly it is activated by H plus. Directly by H plus, because H plus cannot cross blood-brain barrier. So if there is acidosis in the periphery, that is not going to activate the central chemoreceptor, because H plus cannot cross your blood-brain barrier. Carbon dioxide will cross blood-brain barrier, and it will combine with water to form H2CO3, and that will dissociate to form H plus or proton, and that will activate central chemoreceptor, but directly by proton and indirectly by carbon dioxide. So neither by hypoxia nor by something else, nor by acidosis. This can only be activated by increase in the carbon dioxide. So this is the common stimulus for peripheral and central. So always remember that hypercapnia can stimulate central chemoreceptor as well as peripheral chemoreceptor. Okay, why you should not give 100% oxygen to the COPD patient or someone who is cigarette smoker? Can anyone tell me? Although this is for MBBS, I should not go very clinical, but just give you example of that. Why you should not give 100% oxygen to COPD patient or those who are smoking cigarette? What is the cause? Answer is in this point only. If someone is smoking cigarette, so that might be having elevated level of carbon dioxide, isn't it? Yes or no? If someone is chronically smoking cigarette for 10 years, 15 years, so carbon dioxide is increased. So that carbon dioxide is not going to stimulate these two receptors, because threshold will increase. Not oxygen toxicity. Listen very carefully. Not oxygen toxicity. See, if someone is smoking cigarette, there is always a bit elevated carbon dioxide. Okay, so there should not be hypercapnia every time. Hyperapnea, rapid breathing every time. So threshold of central chemoreceptor and peripheral chemoreceptor for carbon dioxide is increase, because there is always increased carbon dioxide. So the only important stimulus is hypoxia. Hypercapnia will not behave normally, because they are already having so much carbon dioxide, isn't it? So if you give 100% oxygen, you are eliminating that stimulus also. So in that patient, their receptor will not acting properly. They will not act properly. This is the only stimulus that is remaining there, because carbon dioxide will be vanished. Threshold will increase. So anyhow, this is how they are acting. And what is the response? What is the response if you activate central chemoreceptor? Let me discuss that. Suppose that you activate chemoreceptor, not central but peripheral. Suppose you activate peripheral chemoreceptors. They have response on respiratory or cardiovascular. Yes. Anyone? They will have response not only in respiratory system, they will not only cause hyperventilation, but they will also activate your cardiovascular. So carotid body and aortic body, these chemoreceptor will activate both respiratory as well as cardiovascular. So everyone knows that whenever you activate chemoreceptor, there is always hyperventilation. There is always hyperventilation. It means increase in the breathing rate, respiratory rate, minute ventilation. But what about CVS? If chemoreceptors are activating CVS, what will happen to VMC and what happened to CIC? Yes, Chandan? If you stimulate CVS, in case of Baro, if you remember, in case of Baro, either you will activate VMC, inhibit CIC, or you will inhibit VMC, activate CIC. But what is difference between chemo and Baro in case of CVS stimulation? In Baro we have discussed, either you will activate VMC and you will inhibit CIC. So both are working in contrast. But if you are activating this by chemoreceptor, yes, very good. Who has given this answer? Priyanshu. Very good. Both will be activated. Now please note this difference, that your cardiovascular center in the medulla, in the nucleus tractus solitarius, they are behaving differently if Baro are activating or if chemo are activating. If Baro are activating, they are working vice versa. Either VMC will be stimulated, CIC will be inhibited, but here both will be stimulated. Please remember, this point is very important. Okay, so if you stimulate VMC, your BP is increased. Your BP is increased. And if you stimulate vagus nerve or cardio inhibitory center, what this will cause? What this will cause? This will cause bradycardia. This will cause bradycardia. Normally when this BP is more, always tachycardia is there. But here there will be bradycardia. So question number 1, when chemoreceptors are stimulated mildly, there will be bradycardia or tachycardia? There will be bradycardia as well as hyperventilation. But you know that whenever there is hyperventilation, okay, it causes inhibition of vagus nerve. It inhibit cardio inhibitory center. So if you inhibit vagus nerve, ultimately that will increase your heart rate, causing tachycardia. So if in Viva it is asked, in your examination, MBBS first prop, that if chemoreceptors are activated, so tell me, Dr. Saab, there will be tachycardia or bradycardia? Then your answer should be both. Initially, it can cause bradycardia, but finally it will cause tachycardia. Yes, Priyanshu, correct. So finally there will be tachycardia, but initially there will be bradycardia. Okay, so it can cause both, but the dominant effect will be what? If you have to answer only one, if examiner said no, you have to tell me only one answer, then dominant effect will be tachycardia. Ultimately, if you stimulate this VMC, CVS chemoreceptors, it will cause tachycardia. So please always remember, so if they ask you that chemoreceptors will cause what? So you can write it separately, that chemoreceptors can cause yes, examiner used to ask you like that, Dr. Saab bataiye. Yes, chemoreceptor, they can cause both. If there is mild stimulation, they can cause bradycardia. and if there is severe or moderate to severe or dominant effect, answer will be tachycardia. So this is the dominating effect. Okay. Now one thing very important for your short note or Viva YC. What are the Mayer waves? What are Mayer waves? This is a separate short note for your exam, and examiners are fond of asking Mayer waves. Don't say Mayor of Lucknow is this. When doctor become mayor, he is called as Mayer wave. What are Mayer waves? So first question is that Mayer waves, you will get Mayer waves by stimulation of baro or chemo. So answer is they are due to stimulation of chemoreceptor. They are due to stimulation of chemoreceptor. So when BP is less than 60, as I have discussed just now, okay, as I told you, if BP is less than 60, there will be bradycardia or tachycardia. Tell me, there will be bradycardia or tachycardia? Pulse will be fast or slow initially. Just now I told you there will be bradycardia, and then there is, after bradycardia, there will be tachycardia, then again bradycardia, then again tachycardia, again bradycardia, then again tachycardia, again bradycardia. I told you mild stimulation will cause bradycardia, and then that can cause tachycardia. So this will be, slow oscillation of arterial pulse during discharge of chemoreceptor, and these are called as Mayer waves. So you will tell your professor that slow, regular oscillation in arterial pulse when during hypotension. It is happening only during hypotension when chemoreceptors are working during hypotension. So this is called as Mayer waves. So sometimes they ask you, okay, you know Mayer waves, very good. So I will give you 8 out of 10. But if you tell me one more wave that is called as Traube's herring wave, then I will give you 10 out of 10. Although they are not related to Mayer waves, but you have told me Mayer's waves, so I am asking one more question. So what is that? So examiner will ask you one more question. What is Traube herring waves? So डॉक्टर साहब बताइए, आपने इतना अच्छा जवाब दिया है. You have given such a beautiful answer about Mayer waves. So can you tell me also about Traube herring waves? So that I can give you 10 out of 10. Although this is not related to chemoreceptor, but just because they are both named wave, then you have to answer that also. What is that? Yes, Ravarma, correct. So these are fluctuation. These are fluctuation in the blood pressure sync with respiration, synchronized with respiration. So change of blood pressure with respiration is called as Traube herring waves. So this is about chemoreceptor in brief according to MBBS level. In PG we can discuss a lot of clinical scenario, but for MBBS this much is, I think, more than enough. But this is 100% you should know. Not a single point you should ignore that or you should skip. So third, I told you after chemoreceptor is CNS ischemic response. Suppose in road traffic accident, blood keep on oozing out and mean arterial pressure become even less than 30 or even 20. That neither baro will work nor chemo will work. Then CNS ischemic response start working. Yes, Nitish, it's respiratory sinus arrhythmia. Yes, you can say it is sinus arrhythmia. You can say that. So, if BP is so low, suppose there is road traffic accident, your normal mean arterial pressure is how much? 100. If there is bleeding, it becomes 70, 60, your baro will start working. But if it becomes less than 60, your chemo will start working. But suppose blood keep on oozing out with some accident and it becomes less than 30, 20. See, BP is so low and there is no one to pick up that patient to the trauma center. So your brain will not get blood. Your brain will not get blood, isn't it? So there will be ischemia at the level of brain. There will be, yes, it is last ditch response. There will be ischemia at the level of brain. See, जब तक कोरोना पेरिफेरी में था, everyone was okay. लेकिन जब प्राइम मिनिस्टर को कोरोना होने लगा, every country wake up. Now president is having corona. So they take immediate action, lockdown and all those things. So similarly, when VMC was acting indirectly, it was not that fast. But now your brain is suffering from that ischemia. अभी तक क्या था? Your body is having hypoperfusion. But now your brain itself is not having enough blood. So this is the first time that VMC is directly stimulated. This is the first time that VMC is directly stimulated, isn't it? Baro and chemo, they are working indirectly through the buffer nerves and all those mechanisms, and they control via VMC. But in this time, VMC is directly stimulated. So Home Minister will be very, very conscious. भाई ये तो अब अंदर पहुंच गया, अब कुछ करना पड़ेगा. Now we have to take drastic action, isn't it? अभी तक ischemia was in the body, so brain was happy. I am getting enough blood. There is no need to do all those things. But now, because VMC, hypercapnia is the most potent stimulator of VMC. Hypercapnia or hypoxia is the most potent stimulator. Of VMC. So because of less blood supply, the carbon dioxide will be more and VMC will be activated directly. Yes. So अभी तक क्या था, VMC थोड़ा बहुत vasoconstriction करता था, BP बढ़ जाता था. But now VMC itself in the danger. इसकी जान पे खतरा पड़ा हुआ है, इसको खून ही नहीं मिल रहा है. So he want to save himself. So he will do highest degree of vasoconstriction. So that will cause, greatest degree of vasoconstriction. You can say greatest degree of, yes, very, very severe vasoconstriction that it can rise. Same process is seen in Cushing reflex. No, Cushing is a bit different. Although it is a variation of same, but I will tell you that is a bit different. It will cause greatest degree of vasoconstriction, okay, so that it can rise up to 200 mmHg. So this is the last method to save your body. So that is why it is called as last ditch stand. Please pronounce it correctly. Don't say anything else like last ditch stand. Okay. It is the last. Yes, it is very significant. Otherwise, you can die. So this is the last method by which you can save your life. Otherwise, even after that, no ambulance is coming. So that patient will die. So the first is baro, then chemo, and then CNS ischemic response. One thing is very similar to that, and that is called as Cushing reflex. Although not related to that BP regulation, but that is very similar. So I can discuss in that. Although time is over, but it will take only 5 minutes. If you allow me. If you allow me, I can discuss that also. It will take only 5 minutes. What is Cushing reflex? Or in 2 year back in MBBS 2017 batch was giving examination, and there was short note on Cushing reaction, and I was just like an observer, I was just wondering. I cannot help any student, but Cushing reaction was the question, and all were very surprised. They know Cushing syndrome, they know Cushing reflex, but they don't know Cushing reaction. So I just hinted them that reflex and reaction both are same. So don't think what is reaction. Syndromes are different, but reflex and reaction both are same. It was asked in MBBS 2017 paper. Okay, and people are very much confused. So don't get confused. Both are same. So this is almost, it is a variation of, it is nothing different. It is just a variation of CNS ischemic response or reflex. So in CNS ischemic response, reflex, your brain was not getting enough blood, but here problem is something different. Problem is that there is increased intracranial tension. There is increased intracranial tension. So if there is increased intracranial tension, there will be compression of cerebral blood vessel, isn't it? There is compression of cerebral blood vessel. Cerebral vessel, you can say like that. So that can cause what? That can cause ischemia, same thing. And ischemia will again activate what? VMC, vasomotor center. And this vasomotor center is going to increase your blood pressure by causing vasoconstriction, isn't it? Yes, very good. And because there is intracranial tension more, it will also compress respiratory center. It will also compress respiratory center. So there will be also irregular respiration. Irregular respiration. So one is that there will be increased BP. Number two, there will be irregular respiration, and you know that always increased BP will activate your VMC. It can activate, as also it can activate your CIC, vagus nerve, to cause reflex bradycardia. Reflex bradycardia. So you can look very conceptually that there are three things. One is there is irregular respiration because of compression of respiratory center. There will be ischemia because of compression of the cerebral blood vessel, which will cause increase in the BP or hypertension. And third is reflex bradycardia. So these three are called as Cushing triad. These are called as Cushing triad. So Cushing triad you can get in Cushing reaction, or you can say Cushing reflex. So please remember that Cushing reflex and Cushing reaction both are same thing. तो अगर एग्जाम में Cushing reaction है तो डोंट गेट कंफ्यूज्ड, जैसे कि 2017 में आया था. ओके, सो आई होप दिस इज क्लियर टू एवरीवन. So thanks everyone, and yes Nitish, please take class on compliance. Okay, so next topic I will take compliance. Any other suggestion? So Nitish asked me to discuss compliance. Compliance is a full question for your MBBS. So next topic, as I will discuss compliance in very much detail. If you get full question in MBBS, it is also your grand viva question. Okay. So thank for today everyone. So this will be a ritual for everyone, that almost daily you will be getting a lot of classes for anatomy, physiology and biochemistry. So this is the first class that I am taking. I am privileged. I am thanks to Unacademy for giving me first class for this channel for first year pre-clinicals. So these are the first two lectures. So thanks a lot everyone. Good night, and if you like this video, please like it and share with all your colleagues. And I request every MBBS student, those who are going to give their first year examination, that please give me topics so that I can discuss those topics, and that will be helpful for your professional examination. So good night everyone. Good night.